Thank you very much. Thank you for inviting us so that we can talk about this subject that affects more than 5.5 million people who are Medicare beneficiaries across the United States. So we're going to be talking about Medicare and things that are associated with Medicare. We're going to start off with talking about SHIP. Now, many of you, I hope, have heard about SHIP as an acronym. It stands for the State Health Insurance Assistance Program. I'm one of the SHIP certified counselors, and our purpose is to help you to understand and deal with all matters Medicare and other related health insurance matters. That's what we're going to be talking about. First, I'm going to talk to you about SHIP, then about Medicare, help to pay for the different parts of Medicare, and I'm not going to talk to you about the Senior Medicare Patrol. Even though that's very important because it talks about Medicare fraud and how to identify Medicare fraud, how to report it, but the discussion is going to be so intense today that I'm going to leave that for a separate discussion. Even though it's been done here before, it certainly deserves to be repeated, but today we're going to focus on Medicare and the most important period in a Medicare beneficiary's life, and that is the annual open enrollment. Okay? So let's start with what is SHIP. That acronym stands for the State Health Insurance Assistance Program. It's a national program that offers one-on-one, unbiased, and free Medicare counseling and assistance. There are 54 SHIPs throughout the United States and the United States territories. It is a federally funded grant program. What we do as counselors is we provide unbiased, free of charge counseling, either on a one-on-one basis, through public education presentations such as what we're enjoying today, or through other media activities so that we can spread the word that there is help in understanding the different parts of Medicare. There's even training that is offered so that people can volunteer to become counselors. Now, I want to point out to you that you'll see that I'm flashing past those numbers. You don't have to worry about that because we provided brochures that have the numbers to our offices, so you're not missing anything if I'm flashing too fast. Okay? Now, before I talk about the impact that SHIP leaves on people that you'll see on this slide, I want to emphasize that you are going to have a lot of questions, general questions and very specific questions, maybe not about SHIP, but about Medicare. I want to encourage you this time to save those questions for the Q&A at the end because this is a lot of material and the material is complex. So I designed the material in such a way, I've had the material designed in such a way that I can talk to you about it, help you understand it, and then at the end, when you get your questions, you'll be able to understand it even better. So I'm going to ask you to hold your questions until the Q&A that we're definitely going to have at the end of the session. Now, back to what SHIP does. It helps people to be in the right insurance policy when it comes to Medicare, and that ultimately results in people saving money. The examples that I give here are just a few of many that we as counselors encounter when someone doesn't do what they're supposed to do in connection with Medicare at the right time, or they put themselves in the wrong plan. It ends up costing them more out-of-pocket expense. So these figures here, like the one that saves this person $17,000, those things are very real, and that is why we are SHIP counselors that encourage you to call us, set up an appointment, and come to our office so that we can help you do the right thing at the right time to save you money so that you can do something else with that money other than worry about being in the wrong plan at the wrong time. Okay? So now that you know a little bit about SHIP, we're going to talk about what SHIP talks about, and that is Medicare. Medicare is a federal health insurance plan or program for certain individuals. You have to be 65 or older. Under 65, you have to be on disability, or at any age if you have end-stage renal disease or ALS, also known as Lou Gehrig's disease. Now, many people don't know that in order to start your Medicare, you don't start at Medicare. You start at the Social Security Administration. That is the organization that is responsible for enrolling people into Medicare and determining your eligibility to Medicare. So if you call our office and you say, okay, I'm almost 65, what do I do? We're going to ask you, do you have your Medicare card yet? If you say no, we say, call the Social Security Administration. That's the number. And we know the number by heart, so you don't have to memorize it. You call our office and we'll tell you. Call because that is where you start. They enroll you into Medicare. Okay. Now, if you are collecting Social Security, you will receive your Medicare card in the mail automatically. The Social Security Administration keeps tabs on that so that you get that card automatically. But if you are not collecting Social Security, you have to sign up for it. You can't sit there and say, I'm turned 65, it's going to happen, and look in the mailbox. It is not an automatic process if you are not collecting Social Security. You have to call the Social Security Administration or go online, and they will process you into Medicare and send you your Medicare card. If you are on disability, you will receive the Medicare card prior to the 25th month that you are on disability. Your Medicare will begin the first day of that 25th month. Now, I hope what you're gathering here as we talk are these facts. There are timetables associated with joining Medicare. There are timetables associated with different parts of Medicare. So, one thing that I have answered is, when do you automatically get the card and when you must take action? So, this slide lays that out for you, that if you are receiving Social Security benefits, then you will receive that card automatically. If you are on disability, prior to your 25th month, you'll receive it automatically. For all others, they must take action and sign up. Through Medicare? No. Through the Social Security Administration. So, by whatever means you receive your card, you now have your card. Is that all you do? No. There are other decisions, and this is where the decision-making process is going to start. If you have other insurance, say for instance, employer insurance because you're still working, then you have to check with that employer to see how it's going to work with Medicare. You may be able to delay collecting or starting your Medicare Part B because your Medicare Part B has a premium associated with it. So it may be that you can delay starting that Part B and save that premium for a later time. Now, I'm going to go into what Part B is, and I'm also going to go into the permission that Medicare gives you to delay that without penalty, so don't worry about that. Once you get the Medicare card, you need to choose health coverage or prescription drug plan. If you do not sign up when you're first eligible, you may be penalized, and that is why it's important that you follow the timetables that Medicare has for you as an individual depending upon your set of circumstances. We may have a class of circumstances, those with disabilities, those who are healthy and 65, those who have Lou Gehrig's disease. But each individual in that class has to follow what Medicare stipulates so that you can get your Medicare started on time and so that there are no penalties associated with it. Okay. Now, let's talk about the parts of Medicare. This card demonstrates the two pathways that there are to getting your Medicare coverage. There are two main ways of doing that. One, now, let me first of all say that if you're looking at your pamphlets, you'll see it a lot clearer, and if you don't have that, look at your Medicare and You book. If you have the 2015, or by now you're probably getting the 2016s, look on that page, and it'll have that much bigger so that you can see what I'm talking about. This describes the pathways to getting your Medicare coverage. Either original Medicare, which means that you have Part A and Part B, and don't worry, I'm going to explain that, or you want to go with Part C of Medicare, which means a Medicare Advantage plan. You have to make that decision as to what you're going to do. When you get your Medicare card and you come to us, this is where we can start our discussion to explain to you what these different pathways do, what the expenses, what the costs are that are involved in it, and which one is better for you. Now, the way we determine what's better for you is we don't tell you that. We give you the information on all of these parts so that you can determine what is best for your life situation. So if you ask us a question, what should I do? We're going to say, this is what happens if you do this, if you follow the path of original Medicare. This is what happens if you follow the path of Part C, which is a Medicare Advantage plan. You'll notice on original Medicare pathway that if you choose your Part A and Part B, which means that you've got your Medicare card, it's going to have Part A and Part B, and you would have had to make the decision as to whether or not you want to keep Part B or not by talking with your employer, like the last slide said. So let's say you decided you're going to keep Part A and Part B. The next decision that you have to make is whether you're going to have a Part D, which is a prescription drug plan. You'll have to make that decision because the Part D does not get put on your card. You get a separate card because the Part D plan comes from the different insurance plans that have prescription drug coverage. After you make that decision, if you are on original Medicare and only on original Medicare, then you have to make a decision as to whether or not to pick up a Medicare supplemental plan, otherwise known as a Medigap policy. You need to make that decision because original Medicare pays 80% of Medicare-approved costs. The Medicare beneficiary is responsible for the remaining 20%. Now that 20% can be small if nothing happens, but if something catastrophic happens, and these days, knowing medical costs, it doesn't have to be catastrophic. One hospital stay, and there's a lot of money involved in that. The 20% that you are responsible for, the way a lot of people on original Medicare take care of it, is the Medigap policy. It is a policy with private insurance companies. You pay that premium. That policy is designed and contracted with Medicare to pick up that 20%. It's going to pick up the 20% that you're responsible for, plus the deductibles that are associated with Parts A and Part B. Not the premiums, but the deductibles. So that is what we're going to talk to you about at the SHIP office in regards to deciding to get Medicare that way. If you decide to go with Part C of Medicare, which involves a Medicare Advantage plan, then we're going to tell you, first of all, that because of the structure of the Advantage plans, you don't need and cannot be sold a Medicare Advantage plan because you won't need it. The 80-20 structure that exists under original Medicare does not exist under Part C of Medicare. I like to think of that C as being comprehensive. It's because a Medicare Advantage plan has your Part A, your Part B, and your Part D all under one organization to take care of your medical needs. So you won't need to have a separate Part D because it's going to be inclusive under that. Now, as we go along, I'm going to get deeper into this, but this is what the general pathways that people have to choose and what's involved generally in those pathways. Let's talk about Part A. Part A of Medicare is hospital insurance. Inpatient care in the hospital, skilled nursing facility care, hospice care, home health care, that is what your Part A of Medicare is going to pay for. Part B of Medicare is known as medical insurance. Part B pays for your doctor visits or other health care like specialist visits, that type of thing, outpatient care, home health, preventative services, durable medical equipment, and the national mail order diabetic supplies. Now, before I go more into the durable medical supplies, let me stipulate that many times people ask the question that, or they make the statement that Obamacare has changed Medicare and has raised it. That simply isn't true. What you call Obamacare is actually the Affordable Care Act. The Affordable Care Act has impacted Medicare in several ways. One of those ways deals with preventative services. The Affordable Care Act has stipulated that Medicare has to include more preventative services that they offer to their Medicare beneficiaries. So that's one of the few ways that we're going to talk about that the Affordable Care Act has impacted Medicare. But it hasn't impacted it as far as the different fees that are associated with the different premiums of the parts of Medicare. okay? Now let's talk about the durable medical equipment. And the reason we're talking about it at this time is because as of July 2013, Medicare has put into place a new arrangement wherein you get your durable medical equipment that is paid for by your Part B. If you want Medicare to pay its part, you have to go through contracted providers or contracted suppliers that Medicare has. You can use your computer if you call our ship office, and we can look up this information for you. If you need wheelchairs, if you need beds, that type of durable medical equipment, you have to go through Medicare contracted suppliers. Whereas it used to be, you could go to places that just sold this type of equipment throughout the valley, and Medicare would pay for part of it. But no longer. Now you have to go through the contracted suppliers that arrange to have the equipment delivered to your home, and they set it up, and Medicare pays this part. Many times I get calls from beneficiaries that says, how come Medicare refuses to pay for it? And oftentimes it's because they did not use the contract supplier. They just used somebody that they knew, somebody that they used before, or somebody that was convenient to them. So remember that you have to use a Medicare contract supplier. You can find it at medicare.gov, and if you do not use a computer, call our offices, and we can do that for you, okay? Mail order diabetic supplies. As of the same date, Medicare has a national mail order program for diabetic testing supplies. Notice I said diabetic testing supplies and not insulin. Insulin is the medication. That's your Part D of Medicare is going to pay for that. But for the testing supplies, that is considered durable medical equipment. Your Part B pays for that, and it does so through the new National Mail Order Program. You will do the same thing. You will use this mail order program. Call them up or go online with them. And if you don't want to do that, call our ship office, and we'll do it for you. And they will deliver it to your home or to a participating pharmacy. You use that system to pay for testing strips, lancets, that type of thing, and that is when Medicare will pick up its portion of the costs. So remember that with diabetic supplies and you're a Medicare beneficiary, you have to use this system now, okay? So we've talked about Part A, the hospitalization insurance. We've talked about Part B, your medical insurance. Now we're going to talk about Part C, that other pathway by which you can get your Medicare coverage. Part C of Medicare is Advantage plans. That means we're talking about HMOs and PPOs. HMOs are health maintenance organizations, and PPOs are provider organizations. In order to receive your Medicare benefits coverage by means of an HMO or Part C, you have to have both Part A and Part B. You don't have to worry about Part D because it comes combined with the Medicare Advantage plans. Remember when I said earlier that C stands for comprehensive? That's because your A, your B, and your D, which is your prescription drug plan, are all under one organization. Now, the next bullet is about why it is that many choose to get their Medicare coverage through Part C, a Medicare Advantage plan. The reason for that is because they include extra benefits that are not under original Medicare, such as a dental or a vision plan. Original Medicare does not offer coverage for dental or vision plan. You would have to get a separate dental or vision plan under original Medicare, whereas under Medicare Advantage plan, they do offer some vision and dental coverage. To find out how much dental and vision coverage, you'll have to call the plan that you select and have that discussion with them. Now, a little bit about the differences between the two. An HMO, you have to use the doctors, the pharmacies, and the hospitals in their network. Otherwise, your plan will not pick up the part of cost that they're going to pick up. If you use a PPO, they allow you to go outside of the network, but you pay a higher percentage than if you used an in-network doctor. So those are the differences between the two, and I've explained a little bit about what Part C is about. Now, let's talk about the next part, Part D. That stands for your prescription drug plan through Medicare. Helps cover the cost of prescription drugs. Different plans cover different medications. You see the numbers that I have up there. Don't get married to those numbers. Don't write them down because they change from year to year. And that is going to become even more important as I talk. But know that many of the plans, they have a premium and some a deductible associated with the plan. They have different pharmacies. Those pharmacies charge different prices. That is why you can talk to your cousin Joe, your neighbor Sam, and talk about the same medication, and you get livid over the fact that you are paying a higher or lower price than they are. When you call our office and say you want to appeal to Medicare because of that, we're going to calm you down and we're going to say there are many reasons that you're paying a different price for the same medication. It may be a different pharmacy. It may be that you're using a standard pharmacy and not a preferred pharmacy. It may be that there's extra help that the other person has that you don't have. There are several differences. We're going to go over those differences with you, and we're going to see if you qualify to apply for the programs that help to lower the cost of medications. But know that different pharmacies charge different prices for medications, and that's one of the reasons why you will pay a different price for the same medication under a different plan. When Medicare beneficiaries have trouble with their providers, Medicare has contracted with a QIO, a Quality Improvement Organization, that handles the quality of the healthcare service delivered, the healthcare being ended too soon, if they did not get necessary health care and other concerns like that. If you feel that this situation fits your Medicare beneficiary, then you will call Levanta. They take care of these matters for Medicare, for you, on behalf. They take care of these matters on your behalf. So that's the organization that we will point you to if you have concerns in these areas. Okay. Now we talk a little bit about the cost of Medicare. Your Part A that you get on your Medicare card, many people call that free. I never call it free, and here's why. You have had to work 40 quarters or 10 years paying into Medicare, actually through Social Security. If you work those 10 quarters, then you've paid for that Part A premium, and that is why you don't have a premium associated with it on your card. So most people can accept the Part A because they've already paid into it already. So I don't ever use the word and say it's free. It just means you've already paid for that, okay? If, however, you have not worked the proper amount of quarters to pay that premium, Medicare has an arrangement wherein you can buy Part A of Medicare, and remember, that's your hospitalization. So you can buy Medicare. Again, I say, as I talk to you about numbers, don't write them down because each year they change. But know that there are premiums associated with different parts of Medicare, like Part B. For the remainder of 2015, that's $104.90 that Medicare charges that will be taken out of your Social Security or that you make payment arrangements to pay for your Part B, that's your medical insurance. Part D has monthly premiums and deductibles associated with it, but there's too many plans to be able to tell you, so I'll just use the word varies as far as the price of the Medicare Part D or your prescription drug plan premiums, okay? So altogether, you have co-insurances, co-payments, and deductibles for these services and medications. And that is why there are assistance programs designed to help you with the different parts of Medicare. The eligibility is based on income and resources. So these are some of the programs. Now, I'm going to back up a minute so that I can talk to you a little bit about it. I was here before and talked, but it's worthy of mentioning it again. The Social Security Administration has a program called Extra Help. If you qualified through income and resources, it is designed to help you with the three components of your out-of-pocket expenses. That is your copayment. It'll lower your copayment on your brand name medications to no more than $6.60, your generic medications to $2.65 if you qualify. The second component is your premium. It'll lower or eliminate that premium that you have to pay for that prescription drug plan. And third is the deductible. It'll lower or eliminate that deductible. So in this way, it lowers the cost of your prescription medications if you qualify for the federal program called Extra Help. That's your Part D, and it only affects the Part D, your prescription drug plan. Medicaid and Medicare Savings Program affects the costs associated with your Part A and your Part B. It helps with the premiums, the copayments, and deductibles for the Part A and the Part B only, not the Part D. So you see why I say Medicare is complex, because Medicare has parts and the parts have parts. So when you apply for help or when you call our SHIP offices, we're going to talk to you about the different parts. So please don't think it's going to be a 10-minute conversation. It's not. We're not just going to ask you your name, ask you what you want, put you together with the plan, and send you out the door. We're going to talk to you about the different parts of Medicare to make sure that you are qualified and are receiving all of the benefits that you are entitled to, because these benefits help to lower the cost of Medicare. So that means when you come to our office, we're going to talk to you about the Medicare savings programs, how there are 3 program levels, how if you qualify through the income and through the resources, what these benefits will do for you. We'll talk to you about all of that. And the reason we want to talk to you about it is because those amounts that you're looking at change. We get sent this updated information so that we can have the most accurate information as to these programs. And here's the Extra Help program that I was telling you about. The other name that's known for is Low Income Subsidy. It pays for all a part of the deductibles and the premiums. It has income and resource qualifications. Okay. Another program that's by the state of Nevada is called the State Pharmacy Assistance Program. It's also called Senior RX, Disability RX. It helps to pay for the monthly drug plan premium. It also helps to pay for your medications when you are in the donut hole. One of the qualifications is that you have to be a Nevada citizen for 12 months prior to applying. Do you understand what the donut hole is? No. Well, I'm glad you asked me. Let me explain. Briefly, what it means is that when you and your plan pay an out-of-pocket expense up to $2,960, you will then experience a much higher percentage of out-of-pocket costs for your medications. You'll pay as high as 70% more for your generic medications and as high as 45% more for your brand name medications. That's until your out-of-pocket expenses reach $4,900. Once it reaches $4,900, it goes back down and you fall into what is called the catastrophic payment level, where you'll pay only 5% for your medications for the remainder of the calendar year, and then it starts all over again in January. So that roughly is what the donut hole is. I call it the medication coverage gap. I don't see a hole there. I see a big crevice that I wish would be closed, and that is one of the other benefits that the Affordable Care Act has done to Medicare. The laws have been created such that that coverage gap is going to be closed by the year 2020. So that's one of the other ways that the Affordable Care Act, what people call Obamacare, has affected Medicare. Okay? All right. You have that number for us, but you don't have to write it down because we provided brochures with you. Now I'm going to talk to you about one of the most important periods of a Medicare beneficiary's life. It is called the annual enrollment period. We have provided brochures that you can take with you as reminders, but you can see by that date, October 15th, that it is quickly approaching. October 15th through December 7th is the period of time during which people with Medicare can make changes to their existing Medicare coverage. Any changes that you make during that period of time become effective January 1 of the next year. What can you do? You should review your current plan for any upcoming changes. You can switch from original Medicare to a Medicare Advantage plan or vice versa. You can switch from a Medicare Advantage plan to a different Medicare Advantage plan, from a Part D prescription drug plan to a different Part D prescription drug plan. Or you can sign up for a Part D prescription drug plan for the first time if you have Medicare Parts A or B. The changes that you make become effective January of the next year. That is why we encourage, that is why we come out and talk to individuals, to groups of individuals about that important date, because that's the time period set aside so that you can take care of your Medicare matters. So, this reiterates the changes that you can do during the annual enrollment period. Now, do you remember the date of that annual enrollment period? Music to my ears, yes. Those are the days. That's good. So you have a reminder and you remember it because it's very important to make the different types of changes that you may need to make concerning your Medicare matters, okay? Now, individual plan changes will be mailed to you with the annual notice of change or the evidence of coverage. You have a plan already in place. Those plans are going to send you a letter. It's either going to be called an annual notice of change or it's going to be called an evidence of coverage, depending on what type of plan you have. But they're going to send you the information on any type of changes that they're going to make during the year, or that's going to be effective for the next year, 2016. So you're going to get that anyway, so that you can be aware. But we want you to make sure that you understand that your Medicare needs may change and the Medicare plans may change, so that you call us during this annual open enrollment period. Now, this Medicare Part D bit containing the coverage gap is going to change as well, but I already explained it to you, but I'd like reiteration because it's such a complex thing. And that reiteration is that the coverage gap, because of the Affordable Care Act, is going to reduce that coverage gap down to where it eventually disappears, okay? And this slide just gives you an example of it, although the numbers can still change now. So we put up the numbers to show that it's actually going to do something. All right, so this is what you do so that you're ready for the annual enrollment period. Look at your current Medicare health and drug coverage. Find out whether your Medicare costs and benefits will change in the coming year. Now, we'll be able to tell you that starting October 15th, and that's why they have it set there, because all of those plans negotiate during the year. They sign contracts with Medicare. Those plans, be they a prescription drug plan or Medicare Advantage plan, they don't have to stay Medicare plans. They can opt out. They're not required to be there. So they have to undergo a negotiating period, what they're going to offer, how much they're going to offer. All of that takes place. So that by October 15th, the contracts are signed for what's going to happen next year. We can see that information October 15th so that we can tell you what your current plan is going to look like in 2016 so that you can see if you need to make any changes. Maybe the medications that are on the plan now aren't going to be there next year. Maybe the premiums are going to lower, maybe the premiums are going to go higher. We'll be able to see that October 15th so that you can make an informed decision as to what to do for 2016. Now, I say we because we're trained as SHIP counselors to do this, so we're a little bit faster at it and we're a little bit better at it. We know the ins and outs. But in fact, you can do it yourself. You can get on the computer and go to Medicare.gov. You go to the plan finder. October 15th, that information is going to be available to you, so you can do it on your own. You don't have to come down and see me. although I'd rather you did, because I'm going to ask you questions that you might not have thought to ask. Don't you get frustrated when you go to a professional and then you leave and say, I wish that I thought of that question. Well, that's what we as counselors are there for, to ask the questions that you need to know the answers to, so that you can make sure that your coverage is complete. That's why we encourage you to call, set up an appointment, and come down to our office or talk to us over the telephone. But in fact, October 15th, this information is available to anybody that goes to Medicare.gov, okay? So look at your plans, determine what your needs are going to be. When you get your annual notices or your evidence of coverage, do not throw them away, read them, because it's the organization telling you these are the changes that are going to happen starting January 1st, 2016 that may very well affect you. And that is why we have this list of questions here. What are my current health care needs? What are my current health and drug costs? What types of insurance do my doctors accept? Those are important questions that you need to ask yourself so that you can be prepared to make changes if you need to, so that your Medicare coverage fits what your needs are. And that's why we encourage you to think about these things now, because that date is rolling around very quickly. This is just another example of what to do to compare Medicare options, to think about coverage benefits, costs, and restrictions. Okay? So let's review. What have you learned? Open enrollment is a period of time each year that spans from October 15th through December 7th, and I know you all got that, and I hope the satellite or remote offices locations got that too. I hope you were able to say that date without looking at it, October 15th through December 7th, because that is the time period that people with Medicare can make changes to their Medicare coverage. You can make changes to your health or drug plans. You can change all the different things that I've already talked about. Those changes become effective January 1st. So you can make it October 15th, but you will continue your same coverage until January 1st of the next year. That's the way it's designed, okay? Read the Medicare notices that get sent to you in the mail. We will evaluate whether or not the special assistance programs can help you with your Medicare costs, and that's why we want you to contact our offices. That is our number. And remember that open enrollment is there. Thank you for listening, and now I'll take your questions.
You mentioned there were preventive vision and dental in Medicare coverage right now. I'm not aware of that, and my eye doctor nor my dentist has ever asked for my Medicare card.
Okay. So the question was, for the benefit of those in the remote sites, was that you weren't aware that there are dental and vision coverages?
Preventive, yes.
Okay, preventive services?
Yes.
Okay. Well, Medicare has a list, and you can get the list either by going online to Medicare.gov, or you can use your Medicare and You book that you get, and it lists the preventative services. It updated the preventative services that Medicare now offers. So you can have that from that list, or go to Medicare.gov and receive it. We have information brochures that we can give you from our ship office. We can mail it to you. So just call our office and say you want the book, and we'll mail it to you so that you'll have it.
Okay, I have one other question. If you're involved with the VA, the Veterans Medical System, and you rank high enough to get your drugs there, and you attend all your doctors there, you don't have to belong to the Part D in Medicare, do you?
Okay.
We don't ever remember like a signing over or saying opting out or anything.
Okay. The question was, if you belong to the VA and you have prescription drug coverage through the VA, do you, I'm going to expand that question a little bit,
yes.
Do you need Medicare's prescription drug coverage? In regards to prescription drug coverage, Medicare allows a few organizations to have 2 prescription drug plans. One of those organizations is the Veterans Administration, but it works a little bit differently. You can't use it as a supplement, meaning if you have a medication and you take it to your VA to pay for it, and you have a copay, you can't then submit that bill to Medicare, to your prescription drug plan under Medicare and have them pay for it because
No
it won't
two
work there.
government.
So
Yeah.
no two government entities will pay for one medication. You'll have to use it for one or the other medication. But the VA members are allowed by Medicare to have a Medicare prescription drug plan. They're one of 5 organizations that Medicare allows that. Otherwise, you can only carry one prescription drug plan, even if that involves you being on the plans that are from the healthcare.gov and you have prescription coverage. When you become Medicare age, you can't keep that and have one so that you have 2 plans. They won't, Medicare doesn't allow that, and you'll be disenrolled from one or the other depending on which you qualify for. Okay? Okay? Ma'am in the back?
Yes, if I'm in a Medicare Advantage plan, can I keep that plan but change to a different Part D supplier?
Okay. The question was, if you are in a Medicare Advantage plan, can you change to can you change your prescription drug plan that is under that Medicare Advantage plan? And the answer to that is no, you can't. And that's because the Medicare Advantage plans come bundled together with your Part A, Part B, and Part D. So they've already negotiated the contract for that. And so it's like trying to go to a doctor outside of that plan. You can do it, but then your plan won't pay for the cost of that other medication. So to realize the lowest out-of-pocket expense, you'll have to stay with that same prescription drug plan that is offered under your Medicare Advantage plan. Remembering that come October 15th, you can change that if it no longer carries your medications. We'll be able to look at all of that information October 15th through December 7th to see if the premium has changed, the deductible has changed, or the medication, what they call the formulary list, has changed so that you can make a decision about whether or not you need to change or not. Okay?
But you'd have to change the entire program.
You would have to change the entire plan because the entire plan encompasses all of that. Yes, sir?
On the donut hole, the $4,900, is that in addition to the first part of that, additional 49, or is that the total of the 2 in the donut hole? Like the first part was like what, 22,000 something?
Okay, so let me.
Then the second part, you said you moved to the 49, you had to spend up to 49. Is the 49 in addition to the 29 you paid, or is that all together?
Okay, I understand your question, but let me reframe it and see if this is what you want to know. The question is in regards to what is involved in the coverage gap. Redefine the coverage gap. There are 2 prices. You enter the coverage gap once you've paid, you and your plan have paid $2,900, $2,960. Now don't get married to that number because that number is going to change, but for right now that's what it is. $2,960. You and your plan have paid. You are now in the coverage gap. And you will stay in that coverage gap, meaning you will pay a much higher percentage for your out-of-pocket costs for your medications until that cost reaches $4,900. Once you've paid $4,900, you are no longer in the coverage gap. You then you enter into what's called a catastrophic level, where you only pay 5% for your medications. Did that answer that question? So the $4,900 is the continuation. You get there when you're paying $2,960. You and your plan have paid that much. Once you get there, you're going to pay a whole lot more for your out-of-pocket expense for your medications. That out-of-pocket expense, any deductibles associated with it, are going to go towards that $4,900. And once you reach that out-of-pocket expense of $4,900, which is inclusive, it's not separate, $2,960 got you there, then whatever you paid is going to keep adding up until you get to $4,900. You have reached the end of the coverage gap and dropped down to catastrophic.
That answered it.
Okay. Yes, sir?
When you're on Medicare and you buy into the supplemental insurance, can that entity, if you decide to go elsewhere, can that entity deny you to come back into that organization?
Okay, repeat that please one more time.
Say I'm covered by an employee insurance
Okay.
as a retiree.
Okay.
And I'm told that if I were to stop that supplemental insurance and were to take something else, I can't ever come back through that door. I can't ever go back to that entity again.
To your job entity?
Right.
Okay. Let me see if I can, I want to repeat the question for the benefit of the remote sites. And remote sites, I haven't forgotten about you. I'm going to open the questions to you too. But let me make sure that I understand the question so I can repeat it. Now, you have an employer
Right.
and you have Medicare. Is
Right.
that- And Medicare is acting as your supplemental insurance.
No, the other way around. The other way around.
If you are a retiree.
I'm retired.
Okay, so you are a retiree, and your retiree insurance is acting as supplement to your Medicare insurance, because that's the way it would be. Medicare is the primary, and your secondary or supplemental will be your retiree insurance.
Correct.
All right, so now you're asking, if with that situation, you're asking, continue.
Well, it's my understanding that that entity, that insurance company or that insurance group can deny you to come back if you were to leave that group.
Okay.
It's like.
Is that so? And you're asking if that's so?
Membership, so to
Okay,
speak.
so you're asking that if you have retiree insurance and you leave that retiree insurance,
Right.
just keeping your Medicare, can you return to that retiree insurance?
Right.
Okay, the answer to that question is, it's going to depend on the retiree insurance, so you'll have to get a hold of them because each plan is different.
So in effect, they can have rules in that plan that say, that do deny you, right?
Each plan, and I'm speaking not of Medicare, but I'm speaking of your retiree insurance plan. Each retiree's insurance plan has different rules that may allow or disallow once you discontinue it. That is why one of the things we say to you is before you discontinue anything from your employer, make sure you talk to two people. One is your plan administrator, and the other one is we're going to send you to what is called a benefits counselor team in Medicare, because the benefit counsel team is a coordinator team. They deal with people who have these dual insurances, so they can tell you exactly what's going to happen. And one of the things that they're going to tell you is to make sure that you talk to your retiree plan to see if you are able to leave and come back, or to see what the specific rules governing that plan and your enrollment or disenrollment. Okay?
I was just trying to make that information available, so to speak.
Okay. All right. Did that kind of
Yes,
answer
sir.
it? Okay. Good. All right. Now let's go to any of the remote sites. Let's start with anyone that has a question in any of the remote sites, because I don't want to leave you out. Is anybody there? Hawthorne, are you there? And do you have any questions?
No?
Okay.
Can you hear us?
We can. I can hear you just fine. Yes. So you don't have any questions concerning the material? Okay.
That's not.
Okay. Very good. How about any of the other two sites? Elko, do you have any questions? Can you hear me? Okay. And how about the third site was Tonopah? Is there anyone from Tonopah there? Okay, now we're going to go back to Las Vegas then. Someone had a question in the back. Yes, ma'am?
Okay, I had big time surgery in February, and I have AARP and Medicare. Didn't know that if Medicare doesn't pay something, AARP won't pay either. And I didn't buy drug coverage because thank goodness I don't need very many drugs. And the hospital drugs was like, I don't know, $2,000 that I'd pay out of my pocket, which I had no idea that could happen.
Okay. For a complete answer, I'm going to repeat the question. But for a complete answer for you, see me afterwards, okay? Because if it's a very specific situation. But the question was about in regards to having original Medicare and having a supplemental plan and how they work together. And one of the things that you need to understand is that the supplemental plan is designed to pick up the 20% that Medicare doesn't pay. But if Medicare is not going to pay for the service, then the supplemental plan is not going to pay for the service. So they don't act in discord. They are designed for it to pick up that 20%. So Medicare has to pay us 80%, then the supplemental will pay for it. Now, that applies to Part A and Part B services. That's your hospitalization, and that is your medical visits. Medications that you receive while in the hospital come under that, but sometimes those categories are very specific because of the way the doctor might have written you a prescription, as opposed to having you have the medication while you were in as an inpatient. So those rules can be kind of technical, and we can explain that, and that's why I invited her to talk to me specifically afterwards, because there are very specific rules regarding those things. Okay, so I hope that answered it in part.
Well, it's done and over with, I guess.
Yeah, I'm just going to make one comment that my lesson learned is to make sure you review your statements that get mailed to you with Medicare every month on this, because there's certain times that the doctor's office miscategorize something and they're going to charge you for it out of your pocket. You go back to them and they go, oh, whoops, we miscategorized it and stuff.
Okay, the comment was made in regards to the statements called Medicare summary notices that you're going to get from Medicare as a beneficiary once you use the service. And this would be a good note for me to end on. Make sure you read all of your summary notices, whether they come from Medicare, whether they come from your Advantage plan. So whether they're Medicare summary notice and MSN, or whether they are any of the other notices, like evidence of coverage notices. Those notices are required to be sent to you. You have the responsibility of reading them, because in many cases you may be able to talk to your doctor, your pharmacy in regards to them. So make sure you read those. Yes, go ahead.
I just have a couple of comments, Ken. I just got a bill from Imaging, and it was $536. And I thought, well, that was, it's quite unusual for me to have to pay that kind of money for a test. So I was going to call my plan first, and then the Imaging people second. So I called my plan. I said, I got this bill. It seems kind of high. So they got the Imaging, the conference call with the Imaging people. I owe them $15. So when you get a bill, question it. Don't just pay it. Question everything. And check with your plan or check with your provider, because I knew there was something wrong. Well, they billed the claim correctly. That's what the bottom line.
Yeah, the code or whatever.
And the other thing is, in the 2016 handbooks that you'll be getting now, plans, the Medicare Advantage plans have changed quite a bit. Aetna and Humana merged. Okay, so there's a lot less plans now between the two of those. So
Okay, all right.
review that. It's at the end of what's behind the back of it.
This is Marianne, my volunteer coordinator, and that's how come she can speak the way that she does about Medicare, because she works in the office and sends me out to here. We're going to run out of time, so let me end with this, and I'm going to take your question.
She mentioned airlifting, I think, or did you have, I want to know if Medicare, a friend got ill up in Italy and had to be airlifted down here, and I believe her husband said Medicare did pay for it. It was thousands of dollars. Is
Okay.
that correct?
All right, so I will talk to you about that afterwards, because the question involved a specific feature of Medicare paying for a particular operation. So I'm going to answer that for her. Anyway, I want to conclude by thanking you for your attendance, and please remember that the open enrollment period is October 15th through December 7th. Please call our SHIP office, make an appointment, or talk to us over the phone in regards to Medicare matters. Thank you very much.
Thank you.